Hi, my name is Dr. Frederick Edward Fabelia, and I will be discussing emotional crisis. Okay, so let's begin. So, an emotional crisis is the beginnings of a mental health issue. What are the signs? Okay, so we will be discussing the different signs. Let's look at the signs one by one. The first one is neglect of personal hygiene. Okay, so this is very obvious. It's something that you can see in others. Another, dramatic change in sleep habits, such as sleeping more often or not sleeping well. Another, weight gain or weight loss usually happens in a very short period of time, like a month or less. Decline in performance at work or school, depending if you're working or if you're a student. Okay. Another, pronounced changes in mood, such as irritability, anger, anxiety, or sadness. Still another, withdrawal from routine activities and relationships. Okay, so knowing when to seek professional help. This is actually what's important. Distress is something that we need to discuss. It is a term used to describe various negative feelings and experiences, which include the following. We have sadness, anger, irritability, fear, anxiety, helplessness, confusion, and embarrassment. So these are all different signs or types of distress. All right. So the question is whether or not a person is experiencing an unusual amount of distress. And we need to know the difference between typical distress, something that we experience every day normally, and distress requiring professional help. All right. So let's look at the difference between typical distress and distress requiring professional help. Typical distress usually has an identifiable cause, such as having an argument with a friend or loved one, performing poorly on a major test or assignment, receiving disappointing news, finding out a friend lied to you. Distress requiring professional help might not have a clearly identifiable cause, such as crying frequently without knowing why, having angry outbursts at others for no apparent reason, feeling anxious in situations that are usually considered non threatening. Typical distress usually has a reasonable intensity given the circumstances. Crying for a few days after a romantic breakup is normal. Feeling butterflies in your stomach before a major exam or presentation. Not talking to a friend for a time after he or she betrays your trust. Okay? Distress requiring professional help sometimes is out of proportion to the circumstances, such as feeling worthless or hopeless after performing poorly on an exam, angry outbursts over small problems, avoiding classes or social situations because they make you feel very anxious. Okay, another difference between these two types of distress, it gets better at least briefly when something good happens. That happens in typical distress. But in distress requiring professional help, it might not get better even when something good happens. Okay, so now that we know the difference between the two, let's consider when to talk to a health professional concerning distress. Okay, your distress leads you to dangerous thoughts or behavior, such as considering suicide or physically harming your body. Your distress lasts for a long time, weeks, months, or even years. Your distress seems out of proportion to your problems. You feel distressed frequently and you are not sure why. You continue feeling bad even when good things happen. Okay? And You find that this stress interferes with your ability to live life the way you want to live it. Okay, so another, you feel the need to use alcohol or drugs in order to feel better. Okay, so these are times when your distress should prompt you to seek professional help. But what about dysfunction? Comes from the root word function. Does the emotional crisis affect your ability to function? Am I having difficulty functioning? So this is the question that we should ask ourselves. Problems require professional help when they persistently interfere with important areas of your life. Ask yourself the following questions, and if you answer yes to any of them, consider talking to your mental health care provider. Okay, first, am I having difficulty carrying out or completing my normal activities and responsibilities? Second, am I unable to do my work, or has classwork suffered because of the way I have been feeling or acting? Another, am I having difficulty interacting with friends, classmates, or strangers? Has my behavior damaged my relationships with friends or family members? Have I been avoiding people or important situations frequently because I have been feeling anxious? Has my drinking or drug use interfered with my relationships, my academic performance, or my other responsibilities? Okay, concern by others is another thing that we should watch out for. Are other people asking me about myself? Ask yourself the following questions, and if you answer yes to any of them, consider talking to your mental health care provider. First, has someone recently told me that I've been acting differently? Another, has someone recently told me that I've been treating people differently? Another, are other people worried about how I've been acting? Usually someone will come up to you and say, I'm worried about you. Another, are other people finding it difficult to interact with me? And another one, has someone expressed concern about my weight or my eating habits? Okay. And has someone objected to or shown concern about how much I have been drinking or using drugs? Okay. So thank you very much for listening and watching. If you want to stay updated with my upcoming lectures, please subscribe to my YouTube channel, Prof. Eric F. Thank you very much.